If your child is struggling with the idea of going back to school, it might be that they're telling you directly that they don't want to go back. It could be that they're complaining about a stomach ache on the morning of school, or that you're having maybe a lot of behaviour on a Sunday night when you know that the school routine and discussion about school is starting again. Then I hope this content will be helpful for you. We're going to have a look at some of the reasons why we see separation anxiety happening and school refusal. We're going to have a look at some of the reasons why we see school refusal happening from a psychological perspective. We will look at some of the things that can drive it from the child's perspective, and then give you some strategies that you can try to use with your child to make the transition back to school a bit more smooth. What is important to keep in mind, I think, or what I tell parents that I work with, is that the distress and the anxiety you're seeing is anxiety, and anxiety about avoiding the school situation for some reason that we don't know yet exactly what it is. It's not that they're being defined, and I think in most cases this holds true, and we need to try and approach it in an empathetic way so that we're not shutting things down that need to be addressed in a bit more detail. So having that conversation and coming at things in a more supportive way and a more neutral way can open up a better dialogue with your child. Another important thing to keep in mind is that when we allow children to have a break from school, although it feels like we're being kind in the short term, in the longer term, it can create a pattern of behaviour that's more difficult to treat. When we know what's driving the behaviour, it means that we can put a plan in place that's going to be more tailored and specific to your child's needs. And keeping that in mind, then we will look at 3 key questions around school refusal. We'll look at why it happens. We look at whether it's an isolated event or something more serious that you might need to get some help with. We will look at what you can do at home to help the transition back to school be a bit smoother for your child, especially after the summer holidays where we've had an extended break. So what does it look like? If you haven't experienced it yourself, you might not be aware. But for those of you who are going through it or have seen it, this is all quite familiar to you. So it could be things like complaining about feeling sick or having a stomach ache. It can be a child who's continually going to the nurse at school and asking to go home early. It may look like a child who's very clingy in the morning time, and when you try to actually leave them at the gate, you can have big tearful outbursts. They can be pleading with you and trying to negotiate, which is really difficult and can make us feel awful when you have to leave a child behind that you know is upset. It can be in an older child, maybe being a bit more irritable, withdrawing and being quiet can be some of the telltale features that we see. What the research shows us is that often behaviour like this happens for a number of reasons, and it's about trying to identify whether one of these stands out to you more than others. Sometimes we see overlap as well between the reasons, so it's not a clear-cut thing and it can change at times, which obviously makes it a bit more difficult to deal with. But going back to what I said initially, when we have identified the driver that we feel is underlying this behaviour, then it means that the plan we put in place is more targeted to and more likely to be successful for your child. So some of the things that can be underlying this behaviour are things like avoiding a situation at school. So there might be something happening that you aren't aware of that they don't want to be participating in. So it could be a subject they don't like, it could be a social activity, so it may be interacting with someone in the classroom. Another driver may be social anxiety, so that it goes back to their interactions maybe with a friend. Could there be bullying happening? Maybe they feel that they're being watched by certain people in their class, or they're afraid of being excluded. They might be going to a new class with new children in the class. Are they afraid that they're going to have maybe no one to play with at break times or to sit with at lunchtime? Is it that they find something at home more reinforcing, or they're more enjoyable at home, and that's driving their want to stay at home? It may be that they want more attention from you, and that they can see if they stay at home, they're going to get more of that attention. And again, it's about trying to pick apart which of these drivers is more impacting your child. School refusal affects approximately 1 to 5% of children, and it's generally seen at the most between ages 7 and 10. So it's important that we kind of keep that in mind as well, that in those times we need to give a bit more consideration to it, and maybe these strategies will be more effective for you if you have a child at that age, and more necessary for you at the moment. I worked with a student called Melanie before, and she was 8 years old. So Melanie, her mum was having a difficult time because she'd started to refusing to go to school, and her mum was working quite a lot, and she had to, obviously Melanie had to go back into school, but it was causing her mum a lot of upset because she could see that, you know, the Sunday nights were getting really stressful. Melanie would be really emotional. Then when she was driving her to school, she'd be sometimes ignoring her in the car. Then when they get to school, she could have just really being very upset. It could be crying, it could be pleading with her mum to let her stay at home for the day. Melanie's dad had also had to get a new job where he was going to be working away a bit more, and the situation at home had changed then for Melanie because her dad was no longer going to be there as often. Her mum was working as well and had quite a busy job, so she had to spend obviously a lot of time then dedicating herself to work as well as looking after Melanie. And another issue that had come up was that school had flagged that Melanie was struggling to regulate her attention and focus in certain topics or certain subjects. They noticed it more in literacy related subjects, but it was something that they were concerned about. So there was quite a few things going on then for Melanie's, and her mum was obviously worried about things. When we have a situation where a child is having school refusal, it can be like a fire alarm going off. Their system is alerting them to the potential danger of a situation, even though it may not be anything to worry about. There may be no fire there, but what's happening is their anxiety is increasing, and that's signaling to them that there could be a threat. And when we think about school refusal, then the type of alarm that we are going to experience will change depending on the situation. So it can be useful to think about 4 different sounds of alarms depending on the particular circumstance or the situation that your child is facing that's creating that anxiety about going back to school. Sometimes I think it can help us to think about things in that way because it's a heightened protective system that our body is using to keep us safe. So when we look at then what can be some of the things that drive school refusal behaviour, research shows that it's not linked to parenting behaviour. So they're separate things. I think that can put parents' mind at ease a bit. It's not their fault or something that they've done necessarily. It's about other factors in the environment that your child is trying to regulate their situation as best they can. It can be due to a stressful event that's happened at home. Maybe you've moved house, maybe you've moved to a new place like the UAE. It could be that parents are maybe going through a separation. It could be that a parent is no longer in the house as often. Again, it can depend very much on the individual child's situation. Maybe there's a sibling who is unwell or a family member who's unwell at home. It can be to do with an isolated incident, or can be to do with maybe a change in the pattern of things that are happening at home. So in Melanie's situation, we know that her dad had, was now doing a job that meant he was going to be away a bit longer. Melanie was finding that school was a bit more difficult for her to manage, and we ended up doing an assessment of Melanie's needs around cognitive skills and also attention regulation. And Melanie was also wanting some more attention from her mum, and they were the main things that came up from her assessment. And we'll talk a little bit about some of the strategies we put in place for Melanie. But before that, I wanted to talk to you about the drivers behind the behaviour that we are looking at, or the psychology behind it. When we see behaviour driven by separation anxiety, so that's anxiety about being separated from a parent or carer, often we see that it's very much linked to that person. So the child might be clinging with you, they're pleading to stay with you. And when you actually drop them off and leave them at school, they will settle after some time when you've left the environment. In contrast to some of the other types of anxiety we see with children who are struggling with this, it's very much about their link with you as the carer that's creating the behaviour or driving things that are happening. How do we support a child then who has behaviour that's driven by that separation anxiety? So things like having a visual schedule in place where they can see how many activities they need to go through before you're going to come back and collect them is helpful. Setting up a regular routine where they understand what is going to happen each morning when they get dropped off, and that what the morning looks like. So what time they have breakfast at, they get dressed, brush their teeth. So those things that are following quite a routine is helpful for the child to anticipate and understand what's going to come next. It can be helpful to have the activity of separating done in a more low stakes situation. So it could be that you drop them off at a friend's house or a grandparent's house. They get that experience of success with separating from you earlier on. So it's not always going to be linked to that time at school where you're dropping them off for the first time. Having a script that you kind of rehearse yourself and trying to keep the goodbye short and sweet as much as you can help things too, because that way you're not drawing it out and then the child's getting more upset sometimes, and then agreeing with the teacher or the nursery, whatever age that the child is, about when you're going to check in to see that things are okay, or can they update you as well to put your mind at rest. So these are things that can help when it's separating from a carer or a parent. And another tip that I recommend to parents is to write down in a diary the type of behaviour you're seeing, when it's happening in the week. Is it school related only? Do you see this separation anxiety with any other activities? Maybe it's an extracurricular activity. Is it being dropped somewhere else that you observe it? Because the more of that information that we gather, it helps to build a picture of what's going on for your child. And it may be that they don't have as much of a reaction when their dad drops them off versus their mum, or vice versa. For social anxiety, often we see that it's to do with a specific situation in school. It might be that your child is avoiding a group activity that they really dislike. It could be PE, it could be a class with other students, for example, a different art class or an elective subject that they're not with that group all the time. If you have a low stakes discussion with your child where you're not asking them loads of questions necessarily, but trying to get them to talk to you about things. Can you get some more clues or information about where they're finding the day is stressful for them? They might give you the name of a child, or they might say, "Oh, I really had a hard time in PE, for example," and then it can help give you some clues as to where things are going wrong, and that can be followed up then with their teacher. And is it to do with a certain group of children? Is it to do with one child? Is it to do with how they're interacting with that person? Or is it to do with feeling isolated and maybe being watched by a group of other children in the class? To help a child that's going through this, we can give them some scripts or just talk them through what they can say in different situations. Can we make one adult responsible for checking in with your child in the school environment, and someone that they feel comfortable to go and speak to when things are not going right in the day? It may be a different teacher in the school, not their actual regular everyday teacher. And often what we will see with this is that it's not so much to do with separating from you as a parent, but it's to do with a specific time of the day. And that can help us to get to the bottom of what's driving that behaviour. If it's to do with academic overload, we will often see a child complain about one subject in particular that they find more difficult. And that can make it a bit more obvious for us to get to the root cause of things. Is your child struggling for any learning reason in a particular subject? Are they finding maths more difficult, or is it to do with English? And in this situation, often if it's to do with them struggling with a particular aspect of their learning and them becoming more aware of it as they get older, it can help to do an assessment with an educational psychologist, someone like myself, that can help you identify and help your child identify what they find more difficult and easier, and get the better understanding of how their brain is working around those subjects. And then we can put specific supports in place to help them to be more successful and to understand themselves a bit more. So again, it's about trying to see where the supports need to be put in place for your child. And if we go back to the example of Melanie, so Melanie ended up being diagnosed with ADHD, and that helped to explain part of her behaviour and what was going on for Melanie. So when she was in certain subjects, she was struggling, and this was then overlapping with some of the changes that had happened at home for Melanie too. What we put in place for her was to have a visual schedule of activities that were going to happen across the day, and Melanie was encouraged to be part of this process, where she would identify times when she would have a movement break, and that gave her a bit of time out of the classroom, and it gave her time to decompress and helped to regulate her attention a bit more effectively. Her mum also put this in place at home, where they had more one-to-one time planned together. So her mum made a point that for 3 times in the week, herself and Melanie would have at least an hour together, where they would do an activity or just talk to each other. It didn't have to be something like extra special, going out of the house and doing things. It was more that they had that time that was dedicated to talking to each other. And Melanie's mum felt that was something that was really helpful, because it gave them a bit of space to talk about school, but also just to have that quality time together. When her dad was away working, he had scheduled times that he would contact her as well, so she knew when to expect that communication with her dad, and that helped quite a lot for her too. In the school environment, her teacher had a system in place where Melanie could signal to her that she needed a break from the classroom, and her teacher then would allow her a bit of extra time outside to engage in a movement break, go for a short walk, and before coming back to the class. The school also set up a quiet area in the classroom itself. So they had a seat and just some sensory materials in one specific part of the classroom that Melanie could access, that also was just separated from the busyness of the class group, and she found that helpful too. And over time, what we saw with Melanie was that things started to get easier for her to manage. She was happier being dropped off. The frequency of that upset started to reduce down. It didn't happen immediately, but it was slowly getting easier for her and her mum to know what to expect. And the Sunday night dread and increase in upset and tantrums was starting to reduce down as well, which was a big relief for Melanie's mum. If your child is experiencing school refusal for some sensory type reason, it will usually be associated with a certain activity. They may be avoiding assembly, for example, or it could be PE they find overwhelming because it's in a really echoey big hall with lots of people shouting and running around. So those types of activities, if we can kind of ask children in a way that helps them to express themselves a bit more, like even if we use pictures and talk them, give them the options and say, at what time of the day do you find this is happening more for you? In that way, then we get more information that helps us to pinpoint where we can put some extra supports in place. And for a child that's maybe experiencing some sensory difficulties, it could be that wearing headphones at a certain time of the day might help them. It could be that they are moving to a different classroom a bit before the rest of the whole class group moves. So they're avoiding some of the noise in that transition time, or they go a bit later maybe to a class. We can also then have the classroom set up or a room set up in the school, if it's possible, where there's sensory and regulation activities easily available to that child, and that can help them to feel a bit more calm and regulated if they need access to more sensory input. But sometimes we can see school refusal happening because of the sensory overload that they're experiencing. It could be sound, it could be visual, it could be just been around more people. Might be a bit overwhelming at the moment. And by identifying those particular times and making these small adjustments, often that can lead to things being a lot more successful and easier for your child to manage and regulate in the day. So then when we think about some other just general strategies that can help, I mentioned already, is keeping the diary of your child's behaviour. When do you see them becoming more upset? What kind of things do they say? And that helps to build a picture. If it's an isolated incident, obviously it's not going to be something that's going to be a long-term issue for you. But if you see the frequency of times where your child is avoiding school increasing over the week, if they were previously happy to go to school and there's been a change in that, it can be helpful to get some extra advice from a professional to give you some strategies to work through and to help assess the whole situation from the school's perspective and from your perspective, to give you a better overview of what's been happening. It can be better to look at doing a graded return to school if your child is in a situation where they aren't currently going to school. You can start off slowly and then gradually build it up. And it might look like things like just going in for 5 minutes and dropping them. You stay at reception, they go into the class for a few minutes, and then you take them home. And it's better to have success then over a few days of doing that and gradually build things up rather than expecting them to stay in school for 3 hours. Over time, you can start to build things up, and explaining to them and being clear about how well they've done on certain aspects of the day will hopefully help to build their confidence and motivation to want to continue. If we think back to the questions we looked at the start, So we talked about why this behaviour can happen. We talked about when it's a once-off or a more serious incident. And if we think back to Melanie, in her situation, it was happening more frequently. We talked about her home situation changing and the fact that she was having some difficulties with her attention regulation as part of her ADHD diagnosis. And then we gave her teacher and her mum and dad strategies they could follow at home that helped to improve the situation. Her behaviour and how things were shown up for Melanie was due to an anxiety related issue. It wasn't due to her being defiant or trying to cause, an argument with her mum. And by taking a step back and looking at all of the patterns and the different factors that were impacting her behaviour, we were able to get to the bottom of things. In the short term, it probably would have been easier for her mum to let her stay at home some of the time, especially in days when her mum was working from home. But she knew in the longer term that would lead to a pattern of behaviour that's much more difficult to change. And with Melanie's situation, once we knew what was driving the behaviour and driving her feelings around the whole situation, it made it much easier for us to put a plan in place that was going to work for her. And that way it saved us trialing different things that wouldn't work. So we were able to get the help that she needed in place quicker. And as a result, it took away the stress for both Melanie and her mum. And the whole sequence of dropping off to school was a lot smoother then. If what I've said today has rang out to you, maybe it's some of these behaviours or it's a situation that you're experiencing with your child at home and you're struggling to manage it, please feel free to get in touch. I'm happy to talk you through the different steps that are involved in the process and how we can help you to put a plan in place that will work for you and your child at home.